Insulin is a hormone produced in the pancreas, one of our organs located behind the stomach. Insulin is very important for the metabolism to work correctly. When blood sugar levels are too high, the hormone insulin stimulates the body to store the excess sugar in various organs such as the liver and muscles. Between meals and in times of stress, blood sugar levels can drop below normal, and in these cases, stored sugar is utilized. Insulin resistance, also known as metabolic syndrome, is a condition in which cells in the muscles, fat, and liver of the human body do not respond correctly to insulin and therefore cannot use glucose in the blood for energy. The pancreas constantly produces more and more insulin to compensate for the increased levels of glucose in the blood and to break the resistance in the cells. Over time, this causes blood sugar levels to rise. Insulin resistance syndrome, which affects an average of 1 in 3 people, can lead to medical problems such as obesity, high blood pressure, high cholesterol, and type 2 diabetes. When individuals show insulin resistance, they usually do not have symptoms or signs that they can recognize overtly. To detect insulin resistance, it is necessary to have a blood test that checks blood glucose levels. Similarly, other conditions that are part of the insulin resistance syndrome, such as high blood pressure, low levels of good cholesterol, and high triglycerides, should also be tested and the results reviewed by medical professionals. When a person develops resistance to the hormone insulin, many signs and symptoms similar to those of diabetes can occur. Darkening of the skin, rapid and excessive weight gain, trouble losing weight, menstrual irregularity, excessive hair growth, feeling low on energy, waking up tired in the morning, sleepiness after meals, concentration and perception difficulties, cold sweating and chills, decreased body resistance, fast eating, frequent and quick hunger, feeling faint, sweet cravings, hand and foot tremor, complaints like I can't lose weight even though I eat less. To diagnose the presence of insulin resistance in individual, the doctor will first inquire about the individual's family medical history, weigh the individual, measure their height, and determine their body mass index. Then the blood pressure will be checked. As a result of these measurements, blood tests will be performed if the individual has the potential for insulin resistance. These blood tests include a fasting plasma glucose test, an oral glucose tolerance test, and a hemoglobin A1C test. The fasting plasma glucose test requires not eating for at least 8 hours. After these 8 hours, blood glucose levels are measured. The oral glucose tolerance test is performed after the fasting glucose test. After the fasting glucose test, a sugary solution is drunk and this blood test is performed 2 hours later. The hemoglobin A1C test shows the average blood glucose level over the last 2 to 3 months. This level is used by doctors to diagnose prediabetes or diabetes. It also helps to see if diabetes, if present, is under control. A repeat test may be needed to confirm the results of this test. If left untreated, insulin resistance or metabolic syndrome can lead to the following list of medical problems: very high blood sugar, very low blood sugar, heart attack, stroke, kidney diseases, eye deterioration and vision problems, cancer, Alzheimer's disease, prediabetes, type 2 diabetes. With the right approaches and lifestyle changes, it is possible to reverse insulin resistance and prevent type 2 diabetes. Exercise is important for this. Engaging in physical activities such as brisk walking for at least 30 minutes a day and at least 5 days a week on average is necessary and beneficial to reduce insulin resistance. It is never too late to increase the amount of physical exercise. It is important to gain and lose weight in a healthy way. Doctors, nutritionists, and certified personal trainers can help individuals who want to know what weight range is healthy and how to reach their target weight. Eating a healthy diet is one of the most important factors. This should include fruits, vegetables, whole grains, nuts such as nuts, fish, beans, legumes, and other lean proteins. In cases where insulin resistance cannot be controlled by lifestyle changes alone, the doctor may prescribe medication to keep blood sugar under control. You can support us by liking the video, writing your thoughts on the subject in the comments, and subscribing to the channel for the development of the channel and more such content.